Working in aged care.
Vaccination and infection control.
I've been working at the aged care centre for over a week now. I really like it. At first, I wasn't sure if I'd be able to do the job. Getting here every morning was a bit hard, but now I'm getting good at it. And I didn't want to do anything wrong, but Judith is always here to show me how to do things. And we have training with Enid. This helps me learn about things for work. It feels good learning new things.
We'd better get these loads on quickly this morning. Enid will be doing the weekly toolbox talk soon and we need to be there.
What's a toolbox talk?
It's training, where Enid tells us about something that makes our job safer. Sometimes it's something like using chemicals safely or washing our hands. She did one on being safe when handling washing, like now, so we don't pick up a disease.
I hadn't thought of that. Is that why we wear gloves for this?
Yeah, come on, let's get these machines loaded. Then we can wash up and get a cup of tea before the meeting starts.
Today, the Toolbox talk is on helping stop infectious disease by immunisation. Who knows what an infectious disease is?
That's a sickness that can be passed on between people, like the flu.
Good example, Lance. Yes, that's right. Infectious diseases can travel from one person to another. The flu is an infectious disease. Infectious diseases are a problem for old people because their immune system, which protects them against diseases, is weaker. It means they can get much sicker because their body doesn't fight the sickness very well.
What about COVID? That's an infectious disease, isn't it?
Yes. COVID is an infectious disease caused by a virus that can make people very sick. A lot of people have died from COVID, and old people can be at greater risk. The good news is that scientists have come up with vaccines that can help stop the sickness, even if people catch the COVID virus. I've already had my vaccination. Who else has?
I was going to get the jab for COVID, but my auntie said it would make me really sick and might kill me, so I didn't get it yet.
I had my first COVID jab last month, and I didn't get sick at all. I know my sister. She got a little bit sick afterwards. She had a headache for a couple of days. That's all. She's good now.
It is hard when there is something new and we don't know much about it, but there is a lot of proof that getting vaccinated protects you and the old people you look after. The vaccine has been well tested and is safe.
Do I have to get a COVID injection?
To work in aged care, here, you have to get vaccinated. We don't want to pass sickness on to our clients. We want to protect people like your Nana.
I don't want to be the one to make Nana sick. I get the flu shot every year because she had the flu 5 years ago and she had to be evac'd out to the hospital.
The flu and COVID injections will help protect your Nana and other clients. It's part of our infection control.
That was really interesting.
Yeah, we have one every week. You'll learn more every time. Created by Culturally Directed Care Solutions, supported by the Australian Government, Department of Health and Aged Care.